So George is a 35-year-old young man who is here because even though he's in great shape, he'd like to improve his texture of the face. There's some mild acne scars, a little bit of color changes, and he'd like to have more of a glow. So we're going to use a glycolic acid peel in a series, and that's going to improve the glow of his face, get rid of some of the superficial stuff that gathers on the face from pollution and whatnot, and also improve some of the acne scars and some of the color changes that he's got.
Wonderful. Let's do it.
So first thing I'm going to do is to cleanse his face, to take off whatever may be on it. Gently. You can see that there's still some colored, dark colored things. I'm going to apply glycolic acid peel, which is a natural acid. It is not a chemical. And we applied it on the entire face. And you're going to tell me after a few minutes what the pain level is, and then I know when to stop it and neutralize it. Usually we keep it on for the first 3 to 5 minutes. I'm going to give you this to take home with you.
I see.
This you can have. This is a facial cleanser, and you have one. This over here is you can apply as a daytime protection cream, which has also a SPF of 23. Okay.
I see.
So he's had the peel now solution out for about 5 minutes or so, which is pretty much the routine that we start with a 20% peel. And now I'm going to neutralize the peel. So close your eyes, please. You can see the light shows that it's obviously neutralizing the acid. And now after this, I'm going to have him sit up and he's going to splash some nice cold water in his face, which I'm sure it's going to feel.
Just in case.
Alright, and now afterwards you're going to be using this cleanser, and there's a lotion over here that I like to use once a day, which has also an SPF factor of 23 for sunscreen, and this will help you as well. And then we're going to see you back next week for another peel. As you know, we do a series of 5 peels, and we start using incremental increase in the percentage of the peel solution, okay? So next week, if we use 20%, if you had a problem, if you didn't have, we'll go up to 35% later. So George, tell me how you felt about the peel, what you felt about the experience, any discomfort.
Actually, this is the first time I'm doing the glycolic acid treatment, so maybe just to say it was a comfortable, tingling sensation, but nothing more than that. Most probably, I'm expecting for skin to start feeling maybe a bit tender afterwards, but then with the home care I'm given, I'm sure we're moving in the right direction. So I'm looking forward to the next one.
Great.
Absolutely.
And this, by the way, is a micro peel, so this will continue to peel, okay? But in a micro fashion, okay?
Absolutely.
It's not like, for example, the trichloroacetic acid, which is a real chemical, which would also change the color of your face and make it red, and you probably wouldn't even be presentable for a while. This is called a lunch hour peel because nobody sees, for the most part, any changes. Maybe a tiny bit of pinkness, but that's easy, nothing much. And after 5 peels, you really get the full impact.
Understood.
All right?
Okay.
So look forward to seeing you again in about a week or so.
Appreciate it. Thank you so much. Thank you, doctor.